As you probably already know, the number of blood cells drops significantly after chemotherapy. This condition is called aplasia. With intensive chemotherapy, like the kind given before a transplant, this drop in cell count is even more severe, and it also takes longer for everything to return to normal. This also affects the cells responsible for immune defense and the cells responsible for blood clotting. As a result, it's especially easy to catch an infection or to bleed more quickly and heavily than usual. And of course, that's not ideal because the skin, intestines, and lungs are already stressed from the treatment. That's why it's important to protect the patient well. So it may be that your child or you as a teenager will need a private room then, and that you're only allowed to stay there. That's why these rooms have their own bathroom and toilet, as well as other features. These are all designed to keep germs out, such as an air filtration system and double doors that function like an airlock. Especially with younger children, most hospitals allow parents to move into the room with their child. The accompanying person is allowed to leave the room occasionally, but must also be very careful. Otherwise, there are extremely strict visitor regulations. Only a very few people are allowed to enter the room because pathogens can be transmitted both through droplets in the air and via objects or through a person's body or clothing. For this reason, those who are allowed to enter the room must wear a face mask and sometimes also an additional protective gown and gloves. So now everything revolves around keeping germs away as much as possible. Normally people say, oh, a little dirt doesn't hurt, but now you really get to go all out, especially when it comes to caring for your skin. So shower, bathe or wash daily, pat your skin dry, apply lotion thoroughly to protect and care for your skin, brush your teeth and rinse your mouth. The whole 9 yards. Just make sure to talk to the nursing staff about which products are good for you right now. Some drugstore or beauty products aren't really the best choice at the moment, and it's better to steer clear of them. Also, regularly check for any changes to your skin, like small injuries, pimples, redness, and so on. If you notice a spot, it's best to report it to the nursing staff right away, even if you feel a bit silly doing so. Better safe than sorry. Germs can also be on food. That's why you should only eat fresh food and throw away anything that's been left out for more than 24 hours. And of course, always follow good kitchen hygiene rules. Things that actually belong in the fridge also shouldn't be left out in your room without refrigeration. But there's another entry point for germs, the lungs. They should always be kept as moist and well ventilated as possible. You can achieve this, for example, by occasionally inhaling a saline solution or by singing. That really does clear out your lungs nicely. Standing or sitting upright is also good because it gives you more room to breathe. So it can already help if you eat your meals at the table instead of in bed. Often it's just these little things that make a difference. But it's also clear, no matter how careful you are and how much effort you put in, you still can't prevent every complaint. So if a problem does come up, please don't beat yourself up thinking you should have done even more. Something can always happen, and that's just part of it. Now I'd like to provide you with a few practical tips on how you can prepare for the everyday life in a single room and what specific expectations you should realistically have. First and foremost, it is absolutely crucial that everything, without exception, that is brought into the room must be thoroughly cleaned and disinfected beforehand. By the way, this also applies to your child's favorite stuffed animal. To prevent it from becoming a breeding ground for germs, it must be machine washable at 60 degrees. If that's not the case with the stuffed animal you have, it's best to make sure you have a suitable replacement in time. Accordingly, you should also avoid dust collectors or hard-to-clean decorative items like ornate picture frames or things like that. A cleaning staff member will come by every day to clean and disinfect all surfaces in the room. That's why it's also super practical if you keep all your toys and other stuff in plastic boxes with lids that can be easily wiped down. You should also make sure to bring enough clothing because bed linens and your clothes need to be changed daily. A great trick here is to put together complete outfits at home and pack them in individual bags. That way you always keep an overview and your things stay clean until you wear them. And while we're at it, toothbrushes, tubes of cream, and other hygiene items also need to be replaced regularly. Another very important thing, the floor is lava. That means anything that lies on the floor or falls down is considered dirty and needs to be disinfected again first. You also shouldn't walk around the room barefoot or just in socks. So please get yourself new shower sandals or slippers that you always wear whenever you walk around in your room. Phew, that was already quite a lot of tips and rules for you to remember. The treatment team will also give you more information about what you need to pay attention to, for example regarding germ-free nutrition, medication, and physical activity. That's because these things are handled a little differently in every hospital. Of course, the weeks or even months that your child or you as a teenager have to spend in such a single room can feel really long, especially because the days are pretty much the same and everything keeps repeating itself. At the same time, though, these routines can also help give your daily life some structure. So that you don't get cabin fever, you could, for example, create a schedule like you would at school. There, you can schedule fixed times for certain activities, for example, for a short workout or a small exercise routine. That's not only good for staying active, it also helps you avoid constipation. It gives your lungs a good workout and just makes you feel better overall. At many clinics, there are physical or sports therapists who are happy to help you put together an exercise program that suits you. You can also set fixed times for phone calls or video calls with family and friends. That way, you stay connected and keep up with what's going on outside. A ritual could also be watching a certain TV series at the same time every day. This way, you always have something to look forward to and ensure a good balance and enough variety in your daily routine. And remember, it's not forever. So it doesn't matter where you are right now, but where you want to go. And also the people at the ward will help you make the best of the situation.